Good morning. So glad that you could join us today. This is the June 19th, 2014 Public Health Nursing ITV, and my name is Joy Hoskins. I'm the Chief Nursing Officer for the department. We have a great agenda today, ranging everything from Shiga-toxin producing E. coli to maternal and child health efforts across the state through local health departments and our partners, and Title 10 updates on the I&E committee requirements, and then I have a few closing updates from the nursing office to share with you. So with that, we'll go ahead and start with Tracy, if you want to come on up. Tracy Bond is a registered nurse and a nurse consultant with the Reportable Disease Branch, and we're glad to have her with us today. She is going to be speaking about Shiga-toxin producing E. coli. Note that this offering counts for not only nursing CEs, but also an ERRT hour, one credit hour. So make sure that you complete your certificate of attendance and submit that per the instructions that the Reportable Disease Branch has sent to you to receive those ERRT hours. So Tracy, I think we've got your presentation all pulled up here. Is that somebody with their mic open? Joellen, can you tell who that is? Somebody's got their mic open out. Okay, you got it. Thank you. Okay, Tracy. Thanks again for being with us today.
Good morning. Thank you, Joy, for having me today. I want to go ahead and start on the presentation because we will be limited for time this morning, and if you could, hold your questions until the end. Okay, the objectives today, first of all, we're going to describe Shiga-toxin producing E. coli. We're going to discuss the signs and symptoms, describe the complications, the transmission and risk factors, the laboratory testing and interpretation, the incidents that we have here in Kentucky. We're going to look at the Shiga-toxin producing E. coli outbreak, treatment options, prevention and control measures, and then at the end, we're going to demonstrate the lab entry for Shiga-toxin producing E. coli into NEDS, because that does seem to be one of the most difficult labs to enter. Okay, what is Escherichia coli? E. coli are a large and diverse group of bacteria that live in the intestines of humans and animals. Most are harmless, but some do cause infection. Some cause...
Estill County, your mic is open. Could you mute it, please?
Estill, your mic's open. Thanks. She's getting it.
Oh, yeah.
Ready? Okay. Some do cause diarrhea. Others cause urinary tract infections, and that's usually from poor toileting. Some also cause upper respiratory infections, such as pneumonia. What are Shiga-toxin producing E. coli? As I said, some cause disease, making a toxin. The E. coli bacteria that makes these toxins are called STEC. Most commonly identified STEC is E. coli 0157, which you hear about a lot. Many other non-0157 Shiga-toxin producing E. coli cause disease. There's actually 50 serotypes that cause human illness. Right now, they are looking at what they call the Big Six, which is E. coli 026, 045, 0103, 0111, 0121, and 045. Some cause bloody diarrhea and kidney failure, which we will talk about a little further into the presentation. So who gets Shiga-toxin producing E. coli infections? People of any age can actually become infected. The very young children and the elderly are more likely to develop severe illness, and also hemolytic uremic syndrome, HUS, which is a type of kidney failure. But even healthy older children and young adults can become seriously ill. What are the signs and symptoms? Primarily, most people get severe stomach cramping, also accompanied with diarrhea, which is often bloody, vomiting, fever if present. It's usually not very high. Most people are better within 5 to 7 days. However, others do become severely ill, and it can become life-threatening. When do signs and symptoms appear? We look at the incubation period, which is the time between actually ingesting STEC bacteria and feeling sick, usually 3 to 4 days after exposure. It may be as short as 1 day or as long as 10 days, though. Often begins very slowly with just mild stomach pain or diarrhea. HUS, which is a type of kidney failure, if it occurs, usually develops 7 days after the first symptom, which diarrhea is normally improving at that time. Complications of STEC. 5 to 10% of our cases who are diagnosed with STEC develop HUS. Signs and symptoms of HUS include decreased frequency of urination, becoming very tired, losing pink color in the cheeks and inside the lower eyelids. HUS does require hospitalization because kidneys may stop functioning and other serious problems may develop. Most people with HUS recover within a few weeks, but some suffer permanent damage or even die. And currently in Kentucky, we have children who are still on a waiting list for kidney transplants, and we have had HUS deaths across Kentucky. Last year, as a nurse consultant for STEC, we actually experienced the first death since I've been covering this disease for 5 years. And by the end of the year, we actually had 2, and these were in perfectly healthy, normal children. So as we talk further, I'd like for you all to keep that in mind as just how serious this can be. So where does STEC come from? STEC lives naturally in the guts of animals such as cattle, sheep, deer, and elk. The major source for human illness is cattle. It causes human illness even though the animals themselves may not be sick. There's other kinds of animals such as pigs and birds, and you may pick up STEC from the environment in which it's spread. When you swallow STEC, it's usually tiny, usually invisible, but amounts of human or animal feces in your mouth is actually what we're talking about. It doesn't sound very pleasant. Consumption of contaminated food, it can be unpasteurized or raw milk, water that's not been disinfected, contact with cattle, or contact with infected feces. Some examples of that would be eating unwashed fruits or vegetables, working with cows in a dairy barn, and then not using proper hand hygiene, changing diapers, eating undercooked hamburger, or swallowing lake water while swimming. They're all risk factors for STEC. Touching the environment in petting zoos, eating food prepared by someone who did not wash their hands after using the restroom. So I'll let you all look at this slide. I think it's pretty self-explanatory as we look at routes of transmission for STEC. STEC can actually contaminate the railings. It can be on the ground, in feed bins, or even on the fur of animals. So that's something that you need to think about with children who are visiting petting zoos, for example. How are STEC infections diagnosed? Through laboratory testing of stool specimens normally. Identifying the specific strain of STEC is essential. Labs that test for Shiga-toxins can detect non-O157s now. Shiga-toxin positive specimens must be sent to the Kentucky Division of Laboratory Services, DLS. This will allow us to have further serotyping and perform what's called PFGE analysis. And that's how outbreaks are identified. That is how Kentucky may be connected with other states. And we often look at those outbreaks nationally. This next slide here is actually an example of the pulse field gel electrophoresis, which we like to call PFGE. As you all can see in the different lanes, you'll have 3 different ends on there, which are the standards. And then if you look at lanes 1, 2, 4, and 5, they're very similar, as we would call indistinguishable. So that is what we would look at in our PFGE lab, and our lab scientists upload these patterns to CDC's PulseNet database. Okay, first of all, when you all get a lab report, it may be preliminary or a presumptive lab. You may get a lab report that says suspicious for E. coli O157H7. Or you may get one that says no routine enteric pathogens isolated, including Salmonella, Shigella, Campylobacter, or STEC. You may get one that says just simply E. coli Shiga-toxin 1 detected, or presumptive E. coli Shiga-toxin type 1 or type 2, E. coli O157H7 positive that may be performed via a rapid test. E. coli 0157H7 non-Shiga-like toxin producing detected, E. coli Shiga-toxin EIA positive, or positive Shiga-like screen. So as you look at this, there's going to be many variations with this. The most important thing to keep in mind is when you get that first test, that's when the investigation actually begins. And if there's a question about the test result, I'd strongly encourage you to call me or someone else in the reportable disease section so that we can look at that test if you have questions about it. Because the sooner the investigation begins, the better food history recall you're going to get, for example. And here in Kentucky, we have what's called the Foodborne Waterborne Illness Questionnaire, which is currently being updated, and we hope that that will be in NIDS soon. But right now, we have the older version of the Enteric Disease Questionnaire in NIDS, and we'll look at that a little bit further once we get into the NIDS demonstration. This next slide is a picture of what they call the immunocard stat testing, and you can see that there's actually a line for the control or toxin 2 and one below. This is the new standard of care, unfortunately, in rapid E. coli testing. It detects all Shiga-toxin producing E. coli and differentiates between the 1 and 2 for optimal patient management while complying with CDC recommendations. It's a rapid test for the qualitative detection of Shiga-toxin 1 and 2, and it's produced by E. coli and cultures derived from clinical specimens only. Here's just a fun picture when you look at testing for non-0157 Shiga-toxin producing E. coli. More and more labs have begun using the simpler test that we just looked at to help detect non-0157. So here you can see an 0111, 0103, for example. Now, once you get a final lab report that's been sent to the Division of Lab Services, you may get a report that says Shiga-toxin positive, unable to isolate Shiga-toxin producing organism. It may say no growth after 48 hours. It may have E. coli 026 Shiga-toxin type 1 positive, 0103 Shiga-toxin type 2 positive, E. coli 0157H7 Shiga-toxin 1 and 2 positive. You may actually get reports back that say Shiga-toxin negative or unsatisfactory specimen for testing or no E. coli isolated. Once again, the final labs also need to be entered into NIDS, and that's what we're going to look at a little bit further in the NIDS demonstration. Okay, I wanted to actually provide you all with a slide that consisted of what you would need specifically for entering the lab report. We will look at this further when we do the NIDS demonstration, but just to reiterate the steps, first of all, you're going to go to Open Investigations, and you'll select the condition, which would be Shiga-toxin producing E. coli for this demonstration, and then you would also make sure that you have the correct case patient. Then you would go under Manage Associations, and then you'll get a little square that comes up, and you will click OK to continue, and then you will add the lab report. It's always important to put the reporting facility in there, and if it's an outreach lab from the Division of Lab Services, there is a quick code that we can put in, and I'll show you that when we do the demonstration. The lab report date, that is very important, and that's going to be at the bottom of your outreach report in the center. Specimen source, very important for us to know if it's a stool specimen, if it's blood, if it's urine, and that's located under the general information of the lab report. Date of collection, that's also very important for us to look at, particularly when we are in an outbreak situation. We like to have that information, so it is necessary to enter that, and that's found in the upper left-hand corner of the Division of Lab Services report. The test results, we will look at the search options that are in NIDS, and there's a long and a short list to look at. The organism is extremely important that you get the correct one in there. Text results, sometimes you actually have to manually enter certain things such as the Shiga-toxin report itself. The result status, when you get a result from the Division of Lab Services, that's considered the final result. We are going to track those isolates if they're positive, so we would say yes, an isolate was received at the lab, or if it was sent to another state public health lab. For example, some of our areas actually have specimens that are sent to maybe Alabama State Public Health Lab or Ohio State Public Health Lab. We can actually enter those results as well into our system, so it's important to know how to do that. The date received, that's going to be up in the left-hand corner as well, and it'll say date or time flagged in. The State Public Health Lab Isolate ID. That's how Kentucky is identified during outbreak situations, and that's going to be the 8-digit lab medical rec number in the left-hand corner as well. Is it confirmed at the State Public Health Lab? Yes. And is it forwarded to CDC? Oftentimes we don't know that, so you can put in unknown. All right. We always refer to our case definitions no matter what reportable disease you're looking at. It's extremely important that you refer to your case definition. So a little bit of background for Shiga-toxin producing E. coli. Yes, it can cause illness that ranges from mild diarrhea to bloody diarrhea, as we've already talked about. It can be life-threatening, causing HUS. STEC are categorized into serogroups by their somatic O antigen. The STEC serogroup most commonly identified, as I've already spoke of, is E. coli 0157. However, there are over 50 other serogroups that cause human disease. In the clinical description, we look at an infection of variable severity characterized by diarrhea, which is often bloody with abdominal cramping. Illness may be complicated by HUS. Some clinicians still use the term thrombotic thrombocytopenic purpura, TTP, for adults with post-diarrheal HUS. Asymptomatic infections may occur, and the organism rarely does cause extraintestinal infections. Okay, when we're looking at the case definition, laboratory criteria that's necessary for confirmation is isolation of STEC from a clinical specimen, E. coli 0157 isolates that produce the H7 antigen. Those are assumed to be Shiga-toxin producing. That's the only one that's assumed to be Shiga-toxin producing. For all other E. coli isolates, the Shiga-toxin production or the presence of Shiga-toxin genes must be determined for it to be considered STEC. Both asymptomatic infections and infections at other sites other than the GI tract, if laboratory confirmed, are considered confirmed cases that need to be reported. Other supportive lab results, you may have a case with isolation of E. coli 0157 from a clinical specimen, but the H antigen is not detected. Identification of an elevated antibody titer to a known STEC serotype from a clinically compatible case. I can say since I've been here, I've actually only seen the antibody titer once, so that's not one of the testing methodologies that you see very much anymore. Identification of a Shiga-toxin in a specimen from a clinically compatible case without the isolation of STEC. I do see those lab reports frequently. When you look at epi-links, that's a clinically compatible case that is epidemiologically linked to a confirmed or probable case. All right. So divide this down into what we call our suspect cases, our probable cases, and our confirmed cases. A suspect case is someone who's had post-diarrheal HUS, looking at the HUS case definition, of course, or identification of a Shiga-toxin in a specimen from a clinically compatible case without isolation of STEC. A probable case is a case with isolation of E. coli 0157 from a clinical specimen without confirmation of the H antigen or Shiga-toxin producing, or this could be a clinically compatible case who is a contact of a STEC case, or is a member of a defined risk group during an outbreak, which is often identified in our case definition. Identification of an elevated antibody titer to a known STEC serotype from a clinically compatible case. Now, in order to meet true confirmation, a case has to be confirmed at the laboratory, and when available, have the O and H antigen serotype characterization that needs to be reported. Okay, just to give you all some idea, I wanted to show you how common STEC infections are here in Kentucky, as you can see in the bottom of the chart. But an estimated 265,000 STEC infections occur each year across the United States. Of those, 36% are 0157. Not all STEC infections are diagnosed still. Many do not seek medical care, and many who do will not provide a specimen. Many labs still, unfortunately, do not test for non-0157. So when you look at the bottom here, you can see in the United States, we had over 5,000 in 2012, over 6,000 in 2011, and in 2010, again, over 5,000. So Kentucky ranks pretty well when you look at our standings. For 2013, we actually confirmed 102 cases here in Kentucky. So that's higher than the previous 3 years. As you can see, 2012 we had 87, 2011 74, and in 2010 70 cases reported and confirmed for Kentucky. When you look at the incidence of Shiga-toxin producing E. coli in Kentucky, we have 0157, 026, and 0103 being the most commonly identified serotypes that we see here in Kentucky. 0157, of course, is the highest. You can see that it starts to increase in April and really peaks in July, midsummer, and then starts to go down back in the fall. When you look here at the top 3 Shiga-toxin producing E. coli serotypes by age, you can see that less than 5 years of age is the most common age. You also can see that females have a tendency to be a little bit higher in the age range of 5 to 9 and 20 to 59, and then also greater than 60 years. Specifically, when you look at 0157 cases, you can see the months of collection down at the bottom and then the number of cases on the left-hand side. July was extremely high last year for 0157 cases here in Kentucky. We had 20 cases reported and confirmed just in that month alone. When you look at the age groups for the 0157, again, less than 5 years of age is the highest. That's why it's extremely important to educate those children on hand washing and watch them when they're going to the petting zoos, and also watching with cross-contamination in the kitchen at home. Age 5 to 9, you can see the females once again outweigh the males. When we look at the 026 pattern, which is our second most common pattern here in Kentucky, July again was the highest month. We had 5 of the 026 particular serotype. And when you look at the age distribution again, this one's a little bit different. You see that the females were between 20 and 59 years of age, but the rest of the cases were males for the 026 pattern, which is a little unique when you look at that. The 0103, midsummer, you're getting July, August, and September. So just a little bit later with the 0103. August was the peak month for those cases. We had 4 cases confirmed in August and 3 in September. When you look at the age and the gender ratio again, females between 20 and 59, also with the 0103 serotype. We had 4 cases of females in that particular age group and 3 males. Otherwise, they're kind of sporadically divided. Now, let's look at our multi-state outbreaks. You are seeing more and more of those advertised on TV. The news gets wind of these, and they like to let the public know, which is good. So when you look at these, there are a lot of things that are commonly eaten. Ready-to-eat salads, frozen food products, spinach and spring mix that you're going to see in your bags section. Raw clover sprouts, very common. Romaine lettuce. We had a large outbreak of 0104 for individuals who had traveled to Germany. You will also see a lot of beef products down towards the bottom that were positive for 0157H7. But now we are starting to see more and more outbreaks that are non-0157. You do see on here that we have the 026, the 0145, and the 0121. So we are seeing more and more of these all the time. We also have the 0145 again on here. When I started in 2009, that's when we had the large cookie dough outbreak. So I vividly remember that outbreak. Kentucky usually has matches that are linked to these national outbreaks. So what you do every day does make a difference with your case investigation. That's why it is extremely important to do it when you get the first lab report that comes in. How long are these infections carried? STEC typically disappear from feces when illness resolves, but some may shed for several weeks or months, particularly with our young children who carry STEC a lot longer than adults. Thus, repeat testing is extremely important with food handlers, healthcare workers, or our school and daycare attendees. Work and school exclusions may differ by jurisdiction. Treatment. When you look at treatment for STEC, it's usually non-supportive, non-specific therapy, such as just the rehydration, getting oral fluids in. Antibiotics should not be used to treat the infection. There's no evidence that treatment with antibiotic therapy is helpful, and actually taking antibiotics increases the risk of HUS. No antidiarrheal agents, so definitely no Imodium. No antimotility agents when bloody diarrhea is present. This also can increase the risk of HUS. So the keys to preventing STEC is cleaning, washing hands and surfaces often, separating raw meats from other foods, cooking at appropriate temperatures, chilling, refrigerate your food promptly. Prevention and control measures: make sure that the meats are cooked thoroughly using a thermometer. Prevent cross-contamination in the food prep areas by thoroughly washing after touching any raw meat, particularly with your cutting boards. That's what we see a lot when we are doing the questionnaires, as people will use the same cutting board for their fruits and vegetables as they used for their raw chicken, for example. That's a definite no. Avoid raw milk or unpasteurized juices such as fresh cider. Avoid swallowing water when swimming or playing. That's extremely difficult for our young kiddos. You know, they are constantly in the pool, in the lake, and what are they doing? They're talking, they've got their mouth open, so there's more risk of swallowing that bacteria. Return a recovered case to food service, daycare, or patient care. The diarrhea needs to be resolved. We need to collect 2 successive stool cultures that are negative for STEC infections, and it's extremely important that they're collected at least 24 hours apart and at least 48 hours after the last dose of antibiotics if they were given. Additional food service criteria for exclusions and restrictions for return to work are in the 2010 Kentucky Food Code for reference. Some of the references that I use today, I do want to make note to you all at the local health department to have on hand, because the same references that I use every day are the very ones that you all need to use. Your CCDM, your Control of Communicable Disease Manual, your Red Book, the American Academy of Pediatrics, which is one of Dr. Brawley's favorites. I also refer to the CDC website and look at the MMWR. Today I want to make specific acknowledgments to a lot of our section staff. Heather Flanagan, who is our assistant epidemiologist in the section now, she did the epi curves and data for me. Also want to recognize our IT department, who is going to help with our NEDS demonstration. We've got Kathy Green, Terry Grimes, and Cervanti. We have a new foodborne and waterborne epidemiologist. I still say new. She's been here about a year now. But J.C. Logston, who I work hand in hand with every day. Also Carol Rush, our lab epi-connector, who I usually talk to at least once a day on the phone. Mike Chardine, who will be helpful for the NEDS demonstration today. I'm sure many of you all have spoke to him on the phone before. And T.J. Suggs, who a lot of you all know as our epidemiologist for our section. You've talked to him many times, probably via phone or via email for your ERRT, or when he worked in preparedness. Okay, I'd like to see if there's any questions before we jump into the NEDS demonstration. I'm going to go ahead and put the link up to the training site that we're going to be using today. You will need the username and password that's listed here, so I'll give you all a chance to log on to that, and if there's anyone that has any questions. Hello, everyone. Today we're going to practice entering Shiga-toxin producing E. coli laboratory reports. So if you are logged into NEDS, you should be able to see the home screen called your dashboard, just like what I'm looking at here, and then you'll click on Open Investigations. All right, we'll scroll over to the condition, and if you click on the arrow, you can click on Select All and scroll down until you see Shiga-toxin producing E. coli. Click, and then hit OK. So when we do that, there's 3 cases of Shiga-toxin producing E. coli, and again, this is in the training environment, so all 3 of these patients have the same name. We're just going to click on the first one, and you always click on the condition, not the patient. Okay, so here you've got the patient brought up, and in order to enter a lab report, you're going to go all the way over to the left-hand side and click on Manage Associations, and then click OK. Okay, from here, you're going to add a lab report. Uh-oh. Scroll back. Occasionally you do get the arrow messages, so we'll try that again. Alright, let's click on the next patient. We'll start back where it says condition. Click OK. Alright, so we'll try the second patient, see if there's maybe a problem with the first one. Okay, go over to the left again, click on Manage Associations, click OK, and then we'll add lab report. Good, it worked this time. Okay. So from here, if you are entering a state lab report, meaning a lab report from the Kentucky Division of Laboratory Services, you can actually click in the white space here and just write in DLS. And then click on Code Lookup. That is a shortcut so that you do not have to search for the entire name. And as you can see, the Division of Laboratory Services automatically populated. Next, you'll go down and click on the laboratory date. And I just have some example lab reports with me today. So you can click on July 7th for the laboratory date. It's important to put the source in there. So if you have a source as stool specimen, you can type that out and it will populate. Date collected. We'll hypothetically go back to June and we'll pick the 25th. And then scroll down. So this is where I think most people get stumped, is in the resulted test. Because when you look at it, you only have options of E. coli O157H7 as a result or an antigen test. And as most of you all are entering preliminary tests, you're only going to have like a Shiga-toxin positive by EIA screen, positive Shiga-like, or possibly Shiga-toxin 1 positive or Shiga-toxin 2 positive. So what you're going to need to do is click on the search button. Okay, when you do this, you have the ability to do a short or long list search. So for this, you can type in ESCH. You don't have to type out the entire word. Click Submit. Okay, so on this first screen, it gives you some options. If you have a final lab report, you can click on Select E. coli serotype result. However, if you just have a preliminary result and it's positive by EIA or Shiga-like, then you would click on E. coli Shiga-like result. So we can do that one first. So typically if you are reporting a Shiga-toxin producing E. coli case, you're going to have a positive result. And then down here you can type in under text result EIA positive or EIA antigen. And then down here, this would be considered a preliminary result because an isolate should be forwarded to the state lab for serotyping and PFGE analysis. So again, if you have positive Shiga-like, and that's exactly what your laboratory report says, you can put Shiga-toxin positive or Shiga-like positive. However your preliminary report reads, that's what you're going to put. So I'm going to clear this to put in a final lab report from the state lab. And once again, you're going to go over to the search button and type in ESCH, submit. All right, and then we have the choices. So once again, if you have a final report from the state lab and they have actually isolated E. coli 0145 Shiga-toxin 1 positive or E. coli 0157H7 Shiga-toxin 2 positive, you're going to select that particular button. All right. Once again, you're going to have an organism choice. And if you scroll down to E. coli, you're going to have the option of E. coli organism or E. coli serotype 0157H7 organism. Well, typically we get reports that are non-0157, and you need to know how to enter those. So you wouldn't use the scroll down arrow. You would actually click on the search button once again, and you're going to type in there ESCH to do a search and click submit. Alright, so on the first screen you're going to see some options. None of those are typically what you're looking for, so you're going to go to the next screen. And if it's a non-0157, don't click on E. coli not 0157. If you keep going, you're going to see several options here. So in Kentucky, we do see several 0104s, 0103s, 0111s. Click on the next screen, you're going to have even more options, 0121, 014, click again, 0145. So from here, we'll go ahead and we'll select the 0145 today. Now, if you noticed, you didn't have options of Shiga-toxin 1 or Shiga-toxin 2 positive, so under the text result is where you will enter this. So you can type in Shiga-toxin 1 positive or Shiga-toxin 2. Occasionally you will get a Shiga-toxin 1 and 2 positive, so you would type that out. And if it's a report from the state lab, it would be considered a final report. So you would click in there, final. Now here at the state, we do track the final lab reports. So you would go down to track isolate, click on yes. Was an isolate received at the state public health lab? Yes, it was. And then they like to know the date it was received. This specimen we put was collected June 25th. So let's say it was received Monday, July 30th. We click on that. And then it asks for the State Public Health Lab isolate ID. If you're looking at a final lab report from DLS, this number is going to be the 8-digit number on the left-hand side under Lab Medical Rec number. So I'm just putting a number in there, 8 digits. Was case confirmed at the State Public Health Lab? Yes, we would not be tracking it if it was not. Was specimen or isolate forwarded to CDC for testing or confirmation? Oftentimes, I don't know for sure, so I click unknown. However, if it was sent to CDC, you can type yes. And then typically if it's associated with an outbreak, we put in there PulseNet isolate, okay? Has PFGE pattern been sent to Central PulseNet database? Yes. Now, these are things that you do not often know at the local health department, so you don't have to go this far. If you have the information and you want to, if you've been notified that your case matches national cluster, then feel free to go ahead and put that number in there. The first enzyme pattern would be clicked in this box, and you would actually type that number out, and then again in this box. So that's as far as we would go with that. And then you would click on Add Test Result. Once your test result is added, it's extremely important to remember to click the Submit button, because if you do not, everything that you've put in there will be lost. So we'll clear this one. Okay, so if you remember, for the resulted test, we searched for E. coli serotype results, and then again, in this box, click Search, type out ESCH, and it will bring you up your options. So if you have a common result of E. coli 0157H7, you can click that here, okay? If you notice, it only says E. coli 0157, so in the text result, you would put H7 if it's Shiga-toxin 2 positive, then you would just type that out. Click on Final once again. And then, yes, we're going to track the isolate. Now, at the local health department, again, if you do not have the rest of this information, after track isolate, you can stop and go ahead and add your lab result and click Submit. Okay. Now I'm going to give you another option of what we sometimes get back from the final lab report. You may get a report that says Shiga-toxin positive, unable to isolate Shiga-toxin producing organism. So if that's what you get, again, you would go up here, see that that's not going to be your option, so you're going to use search. Okay. If your result says Shiga-toxin positive, unable to isolate Shiga-toxin producing organism, you are going to use E. coli Shiga-like results. Here, it would be positive, which auto-populates. And then this is where you will type in unable to isolate Shiga-toxin producing organism. This will be considered a final result from the state lab. Click on Add Test Result, and once again, remember to click Submit. Occasionally, you will get a result back from the state lab that is actually Shiga-toxin negative, and you might have had a Shiga-toxin positive by EIA. So if that's the case, here, you would type negative. Under the text result, you don't have to put anything in there. You're just adding the final state lab results. Click on Add Result and Submit. Once again, these are just examples that I'm putting in there. If you have a question about entering Shiga-toxin producing E. coli laboratory reports, you can call me at 502-564-3261, extension 4245, and my name is Tracy Vaughn. I hope that this did help today. I'm going to cancel since this is training, and we will not add these laboratory reports. Again, go through open investigations, manage associations, and from there, add your lab report. Thank you. Well, obviously with some fruits and vegetables, you can use a colander and using running water and scrubbing them. Other vegetables, for example, when we had the cantaloupe outbreak, that would be a fruit, but they were looking at, whether it was good to use a scrubbing brush on the outside because it's so porous. But sometimes the bacteria is on the inside, and no matter how much you clean, unfortunately, it doesn't get rid of it. But actually, just using the running water and scrubbing vigorously, and using a colander if you have that for strawberries or any other small fruits or vegetables.
The immunocard, the STAT card, can you use it on food?
Not that I'm aware of.
Okay. I mean, to me, that would be a great place to start before you start fixing the dinner. All right.
Dr. Brawley actually sent us something interesting this week that had come out, was that they were advising to not wash raw chicken, because people who were washing their raw chicken, that water would splash up on other things, and so that bacteria would then contaminate anything else that they might have out on their countertop or whatnot. So that's one of the newest recommendations that's come out that he sent to us this week.
Would you say that the majority of cases you've seen, and well, you're looking at 2010 to 2012 with your statistics, are you saying that, since you mentioned petting zoos, is that the most common?
It's not the most common. It is very common. Daycares are very common. Swimming pool and lake exposure is very common. But it ranks right up there with the contaminated foods, cross-contamination in the home. Or, for example, when we have a family that lives on a farm and dad's out working with the cattle and he wears those boots in the house, and then you've got a toddler running around on the floor and the carpet, and of course they put everything into their mouth.
So are there any kind of new recommendations for daycare centers or petting zoos? I mean, I know daycare centers are already using, isn't it a bleach type solution to clean all the toys and surfaces and things like that in the daycares? Is there anything new for petting zoos or for, to advise parents taking children to petting zoos,
Obviously, more and more petting zoos are becoming aware of this as we've had outbreaks with them, so they are offering more cleaning stations around. But I always advise, for field trips or whatnot, to have hand sanitizer at least with them, which is not as good as soap and running water, but it's better to have that than nothing at all if you go to a petting zoo that doesn't have any cleaning stations.
But the hand sanitizer isn't an effective.
It's not as effective.
It's not. Okay, because I understood from the ERRT conference that they needed some type of a bleach solution. Am I correct? Rather than just the alcohol sanitizers.
For cleaning like toys and surfaces, yes. And then we actually recommend the commercial grade dishwasher if available for daycares.
Is that?
I don't think we're going to be able to.
Yeah.
And you may not even be able to show the next presentation because this computer won't.
Okay.
This is just real life.
Yeah, okay. Well, let me get Joelle. Joelle, what we're going to do is go to Plan B. Thank you all for trying.
Thank you, we're sorry.
No, it's not your fault. Let me get up here. Well, thanks, Tracy and TJ. What it appears is, folks, that we've got a perhaps a system or a server issue, and so it's not necessarily specifically related to the NEDS piece of it, but it might be bigger than that. So what we'll do is go ahead and move on to the safe and sound video. I apologize that we did not have the NEDS
We
piece.
can't do the video until that.
Yeah, right. So as soon as if you want to take a break, where the computer here is spinning, gyrating, and waiting, and so we'll wait for like maybe 5 more minutes and see if we can get it up. If not, we may have to reschedule the rest of the presentations for today. Okay?
Okay.
If you want to take a 5-minute break, we'll touch back with us in just a few minutes. Apologize for any inconvenience.